The following show is brought to you in partnership with the Institute of Politics, Policy, and History, Blue Star Strategies, Bright Road Incorporated, Make It Plain Podcast, and RPC Media.
From the campus of the University of the District of Columbia, this is State of Play.
Welcome to State of Play. I'm Sharon Pratt, and with me, Karen Tramontano and the Reverend Mark Thompson. You can find us here each week as we drill down on some of the touchstone issues of the day, the issues that seem to signal major inflection points in our society. So there's racial reckoning. We even saw our democracy in peril on January 6th with the insurrection. And then we have the pandemic, an invisible pathogen that has brought almost everybody to their knees. Today, we're going to drill down just on that issue of COVID-19 and how it's disproportionately impacted communities of color. And so we see the numbers of people who are getting vaccinated, black and brown people, less than, but the deaths greater than. And you have to wonder, is President Biden up to this challenge?
I think so, Mayor. I think what President Biden did not realize is how bad it was. And what I mean by that is how little the Trump administration had done towards implementation and the logistics and distribution. Nothing was together. Nothing was even started. Trump said he had a plan. He had no plan. But I do think President Biden has the right team. He has an experienced team throughout, not only in the White House, but at HHS, CDC. And so they are very much up to the task. But the task is bigger than any of us could have imagined.
Mayor, you're right. This has been devastating to communities of color. The Trump administration did nothing about it. And now Biden has to face the fact that 26.4% of deaths to COVID have been African American, 38.8% of deaths to COVID have been Latinx, and yet African Americans have only been vaccinated to a percentage of 5.4%, Latinx community 11.5%, 60.4% of whites have been vaccinated. So that's a great disproportionality he's going to have to address. Not to mention the loss of jobs, the loss of economy, and to African American Latinx victims of COVID, that's overlapped because those who've lost the most jobs have been in the low paying industries, the low wage industries, and those are the jobs that many African Americans and Latinx citizens work in. If anyone is up to the task, it's the Biden administration. And I think they can do it, but it's going to take some time and it's going to take a lot of work. So
communities of color, the leadership within the communities of color, what might they do? What might we do to be helpful? Because this is one time, it doesn't really matter whether people have any prejudices or not. In order for this society to return to normal, you have to have at least 75% of the population vaccinated. It's in everybody's interest. You know, the Lord seems to be speaking to us about how we need to work together. What do you think, our leadership in our communities can do to help with this situation?
Well, I think, Mayor, one of the things that has to happen, the Biden administration has to meet people where they are. One of the travesties of the Trump administration, among many, was They did nothing in terms of outreach to communities. And I think the Biden administration is well aware that it has to work with community leaders. And community leaders have to be out front and talking to their communities, sharing experiences. And we have to acknowledge that there are very good reasons why communities of color are leery about vaccinations. I mean, especially African Americans.
And I think, too, what is happening, you have members of the clergy and ministers' associations, conferences, trying to educate their parishioners. We've relied a great deal on our African American hospitals, Howard, Morehouse, Meharry. Even the situation with Meharry, even though Meharry's president approved the vaccine as a member of the FDA board, Meharry didn't get the vaccine to the extent that other hospitals in Tennessee got it. So we have to combat all of that. But one of the things I've been saying to my sisters and brothers in the African American community, as much apprehension that is there over the vaccine, if it were meant to harm us, and if that was the agenda, then we would not be so disproportionately short of it. And if 60% of whites are getting it and only 5% of African Americans, then maybe that ought to be a signal that that's something that we should try to seek some equality with as well, the vaccine itself.
Well, infrastructure is everything. And never has the United States or anybody had to get everybody on the planet, or at least 75% of the planet, vaccinated. Nothing that's comparable to this. I mean, even with the polio vaccine, not comparable to this. So, having the infrastructure to pull this off is really a challenge, and especially in communities of color where we never have the infrastructure. So, we'll need the help, I guess, of the military. We need the help of any kind of infrastructure that we can access. That's my thinking. I don't know.
Well, and had we invested in our public health infrastructure, we wouldn't be here. I mean, we talk a lot about insurance and the uninsured and trying to equalize that and close that gap. But our public health system has been decimated for decades. And hopefully we understand now why we need a strong, robust public health system.
Well, we're going to have Dr. Cosette Lyons Jones come on. She's the head of adult health in Watts. So maybe we'll get a sense of what you do, and it's up close and personal. So stay with us here at State of Play.
Closed captioning brought to you in partnership with the Institute of Politics, Policy, and History. Visit IPPH.org for more information.
Welcome back to State of Play. We're talking about COVID, and we're very fortunate indeed to have with us Dr. Cosette Lyons Jones. She is the Chief of Adult Medicine at the Watts Healthcare Corporation in LA. She's also President-elect of the Association of Black Women Physicians. Honored to have you with us, Dr. Lyons Jones.
Honored to be here. Thank you.
We're going to cut to the chase. You've been a consistent and forceful voice around the notion of healthcare disparities in the brown and black communities. Are these disparities, are these the reasons that there are more deaths and negative outcomes in communities of color, or are there other reasons?
I believe that the pandemic has just kind of exploded what we already knew. It wasn't new as far as the deficiencies in the social determinants of health. We, as a community, were made more vulnerable, not because of being Black, but because of being Black in America. Within the context of living here, we're behind the 8 ball in terms of having a context of health that is poor because of not having a job, or having a job that puts us at high risk, that we're not able to shelter in place, or to stay at home and work remotely like some other professions. The spaces that we live in are sometimes multi-generational in context. So that is also something that, we have to contend with. When I look at my patients, I service predominantly Black and brown people of color, such as the Latinx population, as well as African Americans. And our Latinx populations in particular, can roll 5 to 10 deep in a household, and how do you isolate and quarantine when there's 10 people and one bathroom, and 2 bedrooms in a household? If there's poor access to food, if it's a food desert, if there's not enough green space for people to go out and exercise or to safely go outside, all of these things are contributing factors to what we see as drivers for cardiovascular disease, for diabetes, all these other conditions. And that's before the pandemic. So COVID just blew the roof off of that to show what was obviously there, that there's something wrong within the system itself, and that these areas, we talk about equality. I grew up, we talked about we wanted equal, everything wanted equal. We want equal access. The language now is equitable, because my needs may be greater than some other person's needs. I don't need equal amount of resources. I need the resources that will get me to better health, period. And it may require more than someone else gets allocated in terms of resources. And that's how I like to see the government play out in terms of addressing this pandemic, particularly in my community.
And I think that the Biden team has put some emphasis on this. Do you know whether they're reaching out to healthcare professionals such as yourself who are serving our community?
No one has reached out to me personally. However, I do know that they've been reaching out and trying to expand the presence of the community health centers in fighting the pandemic. They are looking to ramp up access to vaccinations, access to testing, mobile units, deploying those on the ground and partnering in communities so that we can see more people that look like us administering the care, giving the information so that it's more trusted, by the recipients, because messaging and the package that it comes in is very important within our community in particular, because of the historic infractions against African Americans in particular, and various other groups of color. So you have to kind of keep that in mind, that it's not just an imaginary thing, or, and conspiracy theorists that are running amok. There's true, tangible things that have happened in America in particular that you can point to as the reasons why people have pause when accepting treatments and vaccines in particular, things that you're injecting in someone's body.
What about the COVID protocols? Do you feel that people of color are beginning to embrace those protocols, like wearing a mask and washing your hands?
I think we're getting better. I know among the population that I serve, my patients in particular, they are not even coming to the clinic. I have to beg them to come to the clinic sometimes to get the blood work that we need to know where they are. It's important for us to empower patients to be able to monitor their own health when they're at home, and to know the signs and symptoms that put them at higher risk, so that they'll reach out and call their primary care physician or go to the nearest emergency room, depending on what the situation is. So we do that by ordering equipment like pulse oximeters to be able to check the oxygen levels of patients at home, blood pressure cuffs, telling patients to get a thermometer. These are all things that help the patient to put their own care in their hands, and to know when to access care if they're in trouble, at home, rather than just sitting at home until it's too late to get the care that they need. So these are the things that are important to me as far as empowering my patients.
Well, thank you so very much, Dr. Lyons Jones. We're going to be right back and get some more of her insights. Welcome back to State of Play. We have Dr. Cosette Lyons Jones. She's helping us understand the issue of COVID. Our colleagues have a couple of questions for her.
Dr. Lyons Jones, we know how devastating this first wave of COVID has been to communities of color. Have we any idea what this new variant may portend?
The new strains are concerning from the perspective of treatment of those people who are diagnosed. The South African strain in particular, we know has weakened the efficiency of the vaccine. It doesn't mean that it has made the effectiveness of the vaccine zero, but we do need to keep in mind, that there is some benefit from the vaccine, even in the face of these mutated strains. Treatment is more concerning, for those people who actually contract the South African strain in particular. When you look at the UK, transmissibility is increased, as a result of that UK variant that's out there that led to Prime Minister Boris Johnson shutting down the UK. All of this is to say that the virus is doing what we expected it to do, which is to mutate. We do have the technology and the capability to pivot and to change the sequencing in the vaccine itself so that we can have newer generation vaccines to administer to the population as needed. The FDA is going to have to work on how to get that to the people's arms quickly, though. And I think they have the blueprint in how we're doing the flu vaccines currently. Each season, we get a new vaccine based on the previous season's strain of the flu. So, we have a blueprint as to how we can do that without having to go through EUA, processes over and over again. So that would be my short answer to a pretty complex question, but people should not become over anxious about the variants because we do have the technology to be able to combat it. The concern would be more so about the drugs to treat those people who actually contract the disease.
Dr. Lyons-Jones, thank you. Let me just ask, what's the one thing the Biden administration could be doing that would make your job easier?
Be consistent with the messaging that is consistent, that is not mixed, and that does not have a punitive tone to it against the victims of the pandemic. Continue to have diversity of voices at the table. The task force is very diverse. You have Becerra out of California, that's in Health and Human Services. Marcella Nunez-Smith. You have a familiar face in terms of Dr. Murphy. So it's great that he has diversity of voices at the table, not just diversity in terms of color, but also diversity in terms of context, experience, and expertise, and that these are all people of science and have solid experiences in the industry to be able to bring to the table in making wise decisions for the nation. The Biden administration is actually doing a great job out the gate of showing the priorities and also showing that all voices matter. So inclusion matters and having diversity of voices at the table is important. And so it's not so much a specific sentence or message as to action is what because I'm tired of rallying cries and, slogans and, words. Words mean nothing without the action behind them to bolster it and to push it forward.
So thank you so much, Dr. Cosette Lyons-Jones. You've been terrific, and we really thank you for your service and your insights. So stay with us here on State of Play. We're going to continue on this important topic of COVID. Welcome back to State of Play. We certainly learned a lot from Dr. Cosette Lyons-Jones. She gave us an earful and great insights, and maybe she's clearly right about as we face this challenge, it may be an opportunity to address some of the health disparities within the Black and brown communities. That was my takeaway.
Well, I completely agree, Mayor. She just pulled the covers off of what has been going on for decades. The disparity in health access, the disparity in healthcare generally to Black and brown communities. There's a reason why the death rate is what it is. When Black and brown communities do not have access to healthcare, do not have access to treatment, they enter this crisis already suffering and putting themselves at risk because of the jobs. They can't work at home. And so it's being hit twice.
It definitely being hit twice. But I think what she also causes us, what Dr. Cosette Lyons-Jones also makes us do, is think about this in macro and not micro. So the vaccine may ultimately save us from COVID. But what about the next pandemic, if there is a next one? And I think we have to be prepared for the fact that this is what happens and may continue to happen as time goes on. If we don't correct the systemic disparities in healthcare and public healthcare, to be honest with you, we've not heard the term, even from those who were advocates of universal health care that much during the pandemic. But what good is it talking about universal health care if there's access on paper, but not real access to communities that need it from qualified hospitals and physicians? So this ought to cause us to, and ought to inspire us to overhaul our entire healthcare system to help those most in need.
No, higher rates of problems with blood pressure, higher rates of diabetes. So, you have so many deficits walking into the situation, as both of you have commented upon. The question is, what kind of incentives, because it's going to take the federal government, I believe, to provide the incentives to make certain we deploy more healthcare professionals into communities of color. What is it? 5% of all of the doctors in our society are African American, and some approximation for Latinx. Not surprisingly, you have these huge deficits.
Yeah, and you also have a huge problem in rural healthcare. So if African American and Latinx communities that are rural, that are outside, and there are many communities that are outside of city centers, outside of historically Black college and university medical centers, they have no access to care. And, the debate has been about insurance. Excuse me, that is a very high-class debate, right? Medicare for all is about insurance. It's not about healthcare access. It's not about eradicating those disparities for Black and brown communities. It's about who gets paid for service, not even to those communities.
Well, coming up next, we have Dr. Kenji Hawthorne, and then we're going to have Dr. Anthony Fauci, who has been terrific in this space. So don't go away. There's more of State of Play.
Coming up, infectious disease experts Dr. Kenji Hawthorne and Chief Medical Advisor to President Biden, Dr. Anthony Fauci.
Welcome back to State of Play, and welcome to Dr. Kenji Hawthorne. For our audience, Dr. Hawthorne is the Infectious Disease Medical Director of the JFK Memorial Hospital in Indio, California. Dr. Hawthorne, we are so pleased to have you, and I know Mark and Karen and I are eager to ask you questions. But before we do, could you just tell us, how are you doing? How are your fellow healthcare providers doing? How is life here in California?
Very pleased to be with you, Sharon. Thank you for asking. It's been a very long road. It's been fatiguing emotionally, mentally. As healthcare providers, we are used to making people better. And so the people who are coming to us, often by the time they arrive to us, they aren't doing so well. And so we're not able to make them better. And so, people have, called us heroes and coming to the rescue. And it's just been deeply humbling to us, because we are used to being able to make people better, and we're not. And so it helps us to understand our limitations.
Well, California has had a tough time. Do you believe that the challenges that you face here in California are emblematic of challenges that will inevitably be experienced throughout the rest of the country?
I believe so. I think that what we're experiencing here in California probably is indicative of a few different things. One is that we're starting to see the emergence of variants of the COVID virus, which is known to be highly transmissible. But during the course of the pandemics, we've had several different epicenters. So during the early stages of the pandemic, there was New York, and there was explanation behind that. And then it moved to Florida and has moved to other areas like the Midwest. And so now we are starting to see an increase in the number of cases. Fortunately, we are starting to see some decrease in the hospitalization. So yes, I believe that this does represent what is probably going to unfold in the rest of the United States.
What does the federal government need to do? What does the state of California need to do to just help make your job and your service easier?
I think messaging is really, really important. And that's been kind of the pitfall of the response since the early days of the pandemic, and also providing a coordinated response effort. So, during the course of the pandemic, it feels like many of us have been working in silos. I know the states at the state level have felt like they're working in isolation of the other states. And, to be congratulated, some states have actually come together and functioned as a unit. And there was significant success in getting the rates down. So I think going forward, we need to look towards getting a unified message, as well as the federal government acting as that lead in helping us to go in the direction that we need in order to reduce the number of new infections, to increase the numbers of people who are being vaccinated.
And through the years, public health infrastructure has been abandoned. And do you think at this moment in time that the federal government and the state government can finally come to a realization that there needs to be a reinvestment in our public health infrastructure?
Absolutely. I believe that if we actually look back to history, where funds were taken away from public health, that led to the emergence of certain infectious diseases. Like, for example, in the 80s, when we had a reemergence of tuberculosis. Now, of course, that was fueled by the HIV epidemic, but that shined a light on how the public health arena had been, budgets had been cut. And so you had services that were no longer being provided. So I think this definitely does shine a light on the need for public health. And it also shines a light on, we're a country, of rights, individual rights. And when you have the juxtaposition of individual rights with the rights of the public to remain healthy, it gets messy. And that's what we've seen over the last several months. And so I think that if the federal government can really insert itself back into where we are used to it being the leader, and showing, hey, this is the direction that we need to go. And if we coordinate together, if we come out of our individual silos and act as a unit, then we can be successful.
Dr. Hawthorne, the rates of infection are highest amongst African-American communities and Latinx communities. Why is that, and what can be done about it?
Right, that's a very complex answer, and it's probably multifactorial. There's so much that we're learning about infectious disease transmission dynamics in general. But particularly COVID has been particularly problematic, especially in people of color, people, brown and Black people. And so often we do hear in our populations that we suffer from higher morbidity and mortality from various chronic diseases and infectious diseases. But it's way more complex than just the color of our skins. There is, that biological factor, but then you take into account the social, environmental, and this is where the social determinants of health have been placed in all caps and in bold. So the health disparities related to race, related to gender, related to cultural differences has really been emphasized. And where I'm located primarily, it is brown people. I'm predominantly in an area where it is Hispanic, but the anxieties that are shared are similar between those groups. And so I think it's really important for us all to remember that we need to protect ourselves. We need to be mindful of each other. We need to be able to step into each other's shoes and understand the difficulties with this disease.
Thank you, Dr. Hawthorne. You've been wonderful. We really appreciate your insights. So stick with us, stay with us here on State of Play. We're going to drill down further with Dr. Anthony Fauci.
Closed captioning brought to you in partnership with the Institute of Politics, Policy, and History. Visit IPPH.org for more information.
Joining us now is one of the world's leading experts on infectious disease. He played a pivotal role in the Trump administration's efforts to combat COVID, an even more central role in the Biden administration's to combat COVID. He is the director of the National Institute of Allergy and Infectious Disease. Welcome now, Dr. Anthony Fauci.
Thank you. It's good to be with you.
Well, we're delighted to have you, and we know there's a great demand on your time, so we want to cut to the chase, ask you the questions uppermost in our thoughts. The first of which is, you have said you believe, and we trust you when you say you believe, that the Biden administration can administer 100 million vaccinations in the first 100 days. The question is, how can they do it with the lack of infrastructure, no existing plan, and no stockpile of vaccines? How can they pull this off?
Okay, so let's take each of those points, Madam Mayor. The first is there's a plan, and the president yesterday at a press briefing held up the 100 and some odd page plan that's there. So there is an official plan. Number two, there is a lack of understanding about this issue of stockpiling. The fact is, during the very early time of the first rollout of the vaccines, General Gus Perna, who's responsible for the distribution of the vaccines, made it clear that he was going to hold back some doses so that there would be a guarantee that those who got their first dose would get their second dose on time. And the reason he held it back was he wasn't quite sure and confident in the ability of the companies in their production to get it out in an even flow consistently. So we didn't want there to be first doses without guarantee of second doses. That was considered by some as a stockpile, which it isn't really a stockpile. It's just the second dose being held back. After a couple of cycles, it became clear that he was much more confident in the ability of the companies to, on an even scale of rollout, he called it a cadence, to get enough out to get the second dose for those who had their first dose, as well as some for those who will be getting their first dose. So they decided they were no longer going to hold things back. That was the confusion about stockpile. The issue about infrastructure is, well, there has always been, in fairness to the Trump effort, that there was an infrastructure that wasn't particularly well articulated. Right now, as you know, from the president's plan, from President Biden's plan, there will be community vaccine centers that will be involved. There will be pharmacies that will have a much, much greater role. And there will be the help and the synergy with the federal government to try and help out at the local level. So that's the answer to the three questions.
Okay, well, that's encouraging. Dr. Fauci, as you know, there's great apprehension in the African-American community, as well as Latinx and tribal communities regarding being vaccinated. How does one overcome that, for example, by engaging trusted, respected organizations within these communities to administer the vaccine?
Yeah, I mean, that's an issue that we are addressing in a very intense way, Madam Mayor, very, very much. I'm investing personally, I would say a significant fraction of my day, talking to everything from black churches to congressional black caucuses, Latinx black caucuses. I mean, any group that will listen to me about that, in addition to good public service announcements from essentially from the government. There are some really important messages that we've got to get and answer the questions. First of all, to respect the hesitancy, because the hesitancy is based on a bad history of relationships between the federal government and medical endeavors. I mean, everyone harkens back to the time of Tuskegee, which was a shameful part of the history, but which you had to admit happened. What we've also got to convince people is that since then, safeguards have put in place that could never happen again. So we need to put that aside and look at what the benefit is to the African American and Latinx community because they are suffering disproportionately from this outbreak in everything from rate of infections to hospitalizations to deaths. So if any group does need to get vaccinated, it's the Black and brown people because they're the ones that are suffering the most.
Well, let me just ask you as one last question because we're running out of time is what is the percentage of the population that needs to be vaccinated to have herd immunity so we can go back to normal?
Well, we don't know the exact number, but on estimates we can extrapolate from our experience with measles. We believe it's somewhere between 70 and 85% of the population, which makes it absolutely essential to get all demographic groups involved.
That's very encouraging. It's a daunting task, but stay with us here at State of Play. We're going to come back and ask a few more questions of Dr. Fauci. Well, welcome back. We're here with Dr. Anthony Fauci, and our co-anchors have a couple of questions.
Dr. Fauci, thank you for your service. We're now back in the World Health Organization. What does that mean to the American people? And are there any consequences of our being out of the World Health Organization for the time we were out?
Well, first of all, it's really a very good thing that we are back in there in full swing. Because when you have a global pandemic, you've got to address it globally. And the idea of not being involved officially in the overarching umbrella global organization just was not appropriate and not the right thing. I don't believe that we missed much of a step by officially being out of it because, quite frankly, several of us, including myself, were as intensively involved with the WHO literally on a daily basis, even though officially it was so-called, we're out, we're no longer a member, and we're going to hold back on the funding. Functionally, thank goodness it didn't make that much of a difference. But it's critical that we're back. We're dealing with a global pandemic. It's got to be addressed globally.
Dr. Fauci, what are some of the social determinants related to the pervasiveness of COVID in our communities that make it so important for communities of color to take this vaccine?
Well, they're the social determinants of health that I hope that the struggle that we're going through together right now finally gets people to realize that we have to make a decades-long commitment to reversing those social determinants of health. If you look at, from an economic standpoint, the situations that Black and brown people find themselves in, most of the time, even though it's dangerous to generalize, the jobs they have themselves in where they're out there in the community face to face with people without being able to do their job through a computer safely away from interaction puts them at a greater risk of infection, number one. Number two, the underlying comorbidities that are much more pervasive in the African American and Latinx community makes it much more likely that they will have a serious outcome once they get infected. And there's the rub, because those social determinants of health are there from birth. It has to do with the diet one has. It has to do with the accessibility to health care, which is the reason why it's not racial. It's the reason why people have higher degrees of diabetes, of hypertension, of obesity, of chronic renal disease. Those are the things we're not going to correct in a week or a month. So the thing I always talk about, and I will continue and mention it now, is that maybe what this pandemic, if it's done anything, is shown a bright light on what the terrible aspects of social determinants of health do to Black and brown people. It puts them always at a disadvantage, particularly when you have an outbreak like this.
Thank you, Dr. Fauci. You've been wonderful. Your insights have been great. So stay with us here at State of Play. We'll be right back when we talk about how we in our communities and our neighborhoods can find ways to combat this virus, COVID. Thank you, and we'll be right back.
Don't go anywhere. We'll have closing thoughts from our panel right after this message.
Welcome back to State of Play. We've had a powerful conversation today with Dr. Cosette Lyons Jones, who explained what it's like on the front line. And then we had Dr. Kenji Hawthorne, who explained the characteristics of this pathogen. And then, of course, Dr. Anthony Fauci, who explained the national strategy, the national plan. All of it was enlightening, but still a little unsettling. This is a massive undertaking, an enormous challenge, but maybe one of the possible takeaways of all of it, it also poses an opportunity to deal with some of the underlying health deficits that exist in the brown and black communities. So at least that's my takeaway.
And how can you achieve herd immunity if you are not addressing the disparities between the white community and communities of color? More whites are being vaccinated than those in communities of color. More of those in communities of color are working in the low-wage jobs where they're more likely to become infected. So I think that's the challenge that we're facing. And if there was ever an opportunity to address that, it's Dr. Fauci working with a Dr. Cosette Lyons and others, while also working with an administration that is at least amenable, and I believe the Biden administration is more than amenable, to trying to address some of these disparities.
Mark, I think you're absolutely right. The Biden administration is much more amenable, but I think we have to also stay focused and continue to put pressure on the Biden administration, on Congress, because once we have herd immunity, everybody's going to forget about these healthcare disparities. And as you said earlier, we're going to have another pandemic. There's going to be another crisis, and we're going to end up exactly where we are with black and brown people really shouldering the brunt of this, again, experiencing the high death rate. So we've got to stay focused, and we've got to message very clearly that it ain't done until it's done. And these healthcare disparities have to be corrected.
Yeah, but it all costs money. And we saw the pushback even with the stimulus bill. It all costs money. And trying to get people to ante up for communities of color has always been a challenge.
Well, the overall economy is sunk when communities of color are not able to work, are not able to care for themselves or for their children. And as we talk about this stimulus, I believe someone in the administration said recently, it's more of addressing hardship than stimulus. Stimulus is when things aren't as bad as they are now. This is bad. This is about dealing with hardship. And we can't have half the population homeless, hungry, broken, unemployed. So we've got to do this in order for the economy of this country to survive.
Well, I think this has been a rich conversation, at least in terms of a better grasp of how this is impacting communities of color. I mean, we've had 3 terrific doctors who understand it from different lenses. And what we do here, I think, we hope, all 3 of us, that State of Play does a deeper dive around all of these touchstone issues of the day, how those issues impact communities of color. So that's what we're going to do each and every week. So join us again next week for State of Play.